We don't often stop and look back, but for the next few minutes, I want you to do just that. Yes, we're the fastest growing district in the state. Yes, we have some unique challenges. And this year in review shows why I have so much confidence in the future. 2014 was a year of outstanding achievement across the district. You can read the report in full on our website. But for now, here's just a small taste of the people, the teams and the communities who have ensured we've continued to deliver leading care, healthier communities. Thank you.
Enhancing our assets and resources.
Campbelltown's $134 million redevelopment opened with pathology lab, outpatient and ambulatory care and a refurbished emergency.
So Campbelltown's redevelopment has been fantastic because what it's done is it's allowed all the people that are moving here, which is approximately 1,000 new families a week, to access high quality services closer to home.
And a $9 million clinical school will be key to workforce development.
As it brings together University of Western Sydney and Campbelltown Hospital in a key partnership. If you train people locally to where they live, they're more likely to come back and work in the area.
Research and innovation.
The Centre for Oncology Education and Research Translation received a $6.5 million 5-year grant. 5 universities and 3 LHDs will focus on translational research.
So the idea of translational research is to link all of those researchers so that there's a path for whatever's developed in the laboratory to be taken into clinic and then into policy and practice, and to try and improve quality of life and extend people's survival wherever we can.
And 3 academic units were established: respiratory health, mental health and radiation oncology.
The purpose of research is making people better. So having a strong research and academic culture improves patient care. You'd be crazy not to want to have academic units within your health service, and fortunately we're not crazy.
We held our first Innovation Forum. It won't be our last.
It brought together a range of staff from different services who probably wouldn't normally interact. We've now developed projects and we've been funded, so it's really up to us to kind of prove that there's some value in those projects.
Innovation also took place at the ward level.
The safety huddle idea came from the Falls Working Party, so we rolled it out here and we've had some really good success. I've brought the team around as we discussed earlier.
I moved forward a bit too much in the chair and tipped it over.
So when you tipped from the chair, do you know if the foot plates were down?
So we've gone from 4.2 falls to 2.2 falls per 1,000 occupied bed days, which is significant. And involving the patient is a key component, and make sure that they're on board with the recommendations and strategies, and often come up with the recommendations and strategies themselves. I think that's very important.
And introducing tablets to our community nurses means a seamless link between the nurse, patient information and documentation.
I can see all the nurses that have come and seen you in the past.
Developing our staff.
We opened the Nagara Education Centre, a purpose-built centre for all staff.
It is important to ensure that there isn't the focus on training and education just for the medical professions. There is a suite of education and training for everybody.
And it also builds upon our own fundamental clinical skills before we actually see patients as well.
And Liverpool's Simulation and Training Centre took training to a whole new level with the anatomage table.
This amazing new tool where you've got your whole sort of anatomy of the human body, and you can show where all the injuries occur, and you can upload different scenarios.
It is a big iPad that allows you to visualise the human body, and when I started learning anatomy, we didn't have anything like this.
The district continued to invest in our activity-based funding strategy by recruiting specialist staff to help drive performance.
Providing high-quality care.
At Campbelltown Hospital, an investment in radiation oncology will improve patient care.
We've installed 2 new treatment machines called linear accelerators that deliver high energy radiation very precisely to tumours and replace surgery in particular tumour sites. We know that travel is a real imposition on patients when they're feeling unwell, so having these 2 machines at Campbelltown, it's geographically accessible, it's financially accessible, and then without waiting lists for treatment.
We continue to focus on our national emergency surgical targets. An excellent example was paediatric ear, nose and throat.
We did over 240 children here at Bankstown. Children who have recurrent tonsillitis or throat infections, then that will mean days off school, days of antibiotics, and sometimes even days in hospital. And that's why the operations are so important.
The party program at Liverpool Hospital was rolled out, bringing students from the school environment into a clinical environment and showing them firsthand what the consequences are of risk-taking behaviour. The Aboriginal Chronic Care program was extended and enhanced. It now includes a cardiology specialist, exercise physiologist program, and complementary drug, alcohol and mental health services. A number of system changes were made to improve service coordination and patient outcomes. And at the Fairfield Hand Clinic, 9,000 patients were treated by a doctor, 6,000 saw nurses, and over 4,000 saw a hand therapist.
It's certainly become a very successful one-stop service within the district, and the staff work incredibly hard to cater for the volumes, and only because of their dedication that's been so hugely successful for us here at Fairfield.
Seamless networks.
We opened Oran Park, our latest community care initiative.
It's an integrated primary care centre, part of the Southwest Growth Corridor, so it's providers providing a whole range of integrated services, so it's seamless and available to people when they need it, closer to home.
The In Safe Hands program, structured interdisciplinary bedside rounding and communication with purpose are transforming the way we work as teams and are real positives when it comes to consistent care and patient involvement.
Good morning, this is Triple I. How can I help you?
The Triple I Hub Call Centre, a centralised information and intervention service, now manages all referrals to the Palliative Care Peach program for 5 LHDs. Triple I Hub is a vital link for hospitals and receives over 6,000 consumer calls every month.
Worked in nursing for 42 years, and I think that the greatest challenge was people didn't know the multitude of community health services out there, and having a one-stop shop, a hub.
Is she having a newborn baby?
It's amazing, and I think I've got a passion for this. I think it's a great need. It's exciting. It's a great team here, excellent team, and I think we do an amazing job in this place.
We began implementation of the Information Management and Technology Plan. Clinicians and managers will have better access to high-quality information and technology systems to ease work, promote innovation and improve patient care. The district maintained a strong position financially, delivering high-quality services within budget and met targets to ensure our valued small business providers were paid on time.
Community partnerships.
The Liverpool Mental Health Unit joined forces with the ABC for Changing Minds, an award-winning 3-part doco.
My big wish as a psychiatrist is that people can say, hey, I've had treatment for mental illness, I'm me, and that'll be great.
Al Nouri School stepped in to help Bankstown's emergency department.
The Lucas machine is an automatic chest compressor, and one of our nurses' children actually goes to the local Muslim school. And they heard that we needed one.
I took that initiative to our Student Representative Council. The challenge is to raise $22,000 for a Lucas 2 machine for Bankstown Hospital. I want it done before the start of the month of Ramadan.
Within 2 weeks, they actually raised $22,000, which is an absolutely fantastic effort. So it's already saving lives.
Dry July raised over $170,000 for MacArthur and Liverpool Cancer Therapy Centres.
So very much the Dry July has allowed us to now get a wellness manager, a different type of support for patients beyond this kind of initial illness phase.
And community and consumer participation continues to strengthen. It has broadened its diversity, increased membership and expanded in community health and oral health services to increase engagement. The Patient Experience Tracker has been another initiative,
That particular project is a real shining light for consumer participation, working with patients and carers to ask them questions about the services that we provide, to get responses in a timely way, and to generally have a good patient engagement project.
Trained palliative care volunteers support patients and staff in Camden. Auxiliaries across the district improve the quality of care we deliver every day. Bowral Hospital celebrated 125 years of service. The local credit union funded a mental health children's nurse, and the auxiliary stepped up for a maternity ward in need.
So the crib was donated by the Bowral Hospital Auxiliary, and at a cost of nearly $30,000. That's pretty significant. I have young Rafaela, being a wee little thing. She didn't really have the ability to actually maintain her warmth. By having a crib like this, we could actually provide that environment. If we can't provide it, their babies get transferred off to a higher level facility. So I think from looking after our people in our local community, it's really important that we keep the families together.
In any given week, over 200 babies will be born, around 5,000 people will attend our emergency departments, and over 1,000 surgical operations will be performed. The vision is clear: to build a healthier population in southwestern Sydney. I look forward to working with you to achieve our vision of leading care, healthier communities.